So what exactly is the Edmonton Protocol? The Edmonton Protocol was developed in 2000 by a team of researchers at the University of Alberta, led by James Shapiro. The procedure has been shown to improve the quality of life for patients with hard-to-control diabetes. Long-term results show that the procedure is safe, reliable, and effective, with 50% of patients remaining insulin independent after 1 year and 25% after 5 years. The rate of adverse events has also improved significantly, with 78% of recipients not experiencing an adverse event in one period compared to 34% in another. A 2022 study found that 61% of patients who received a transplant between 1999 and 2019 were insulin independent for a year after surgery. 20% of the patients were still insulin independent after 10 years. The biggest challenge is that thus far, insulin independence has not always been sustainable over a long period. Islet cell donor pancreases are not very plentiful. This issue has been covered on this channel in past videos and is being worked on through potential islet cell manufacturing. This is a separate topic, so for now, let's see what Dr. Shapiro's views on the topic of type 1 diabetes are at present. Here is what the doctor had to say in his interview with JRDF. I am particularly excited about stem cells for the potential to cure not just T1D, but all types of diabetes. Injected insulin is life-saving in the short term, but the subcutaneous fat is a weak link in the chain, failing to provide perfect glucose control. Stem cell-based treatments have the potential to function in a way that most closely resembles the process of insulin release and control that happens from moment to moment inside the normal healthy body. However, as of right now, powerful anti-rejection drugs are required for cell transplants to survive, and these drugs carry potentially risky side effects. So, this means it's not currently a good option for children and many adults. I'm most excited about the potential to make personalized cells, using an individual's cells to work as a treatment. This is the biologically closest option from a concept perspective, albeit the hardest from a manufacturing standpoint using today's methodologies, but this will change and become much simpler over time. We need to still deal with autoimmunity in T1D, but this can be potentially achieved either through biological drugs or far milder gene editing. I'm very excited about the progress of T1D research, especially within the last 5 years. But I believe that a cure is really within all our grasp. It's going to require intense collaborative scientific effort and a lot of funding, but I firmly believe this is possible and will happen. Preventing T1D at the outset in children and adults at the highest risk would have the biggest future impact, avoiding the need for transplants. Preventing autoimmunity in the beginning stages and combining that with islet cell differentiation techniques learned from all the work with stem cell research could be applied early enough to prevent T1D from occurring. If we can induce cellular regeneration in the pancreas and the native islets along with stopping autoimmunity, that would be an elegant solution to reduce new cases of T1D. The challenge is doing this without inducing pancreatitis and other risks to the organ. Treating patients and preventing the disease will be an incredibly important next step. Stem cell therapy is tantalizingly close, which is why I can't stop thinking about it day and night. But I see new frontiers every day in the treatment of all types of diabetes. As we have covered on this channel, there are many potential avenues to solving this problem of type 1 diabetes, from regenerating beta cells using the patient's cells, to making new beta cells from scratch with custom-designed characteristics of the patient's DNA to avoid the immune response. The potential is very exciting. Jim.